Hello, everyone. I hope today finds you doing as well as possible in our wackadoo world. Um, I thought I would do an update and some information sharing also as well, um, because some information was shared with me. And this information, of course, is not meant as medical instruction to anyone. It's just for informational purposes only. But you may want to have a look at some things if you had any kind of illness similar to mine. You may want to look at information connected with what I'm going to share with you. The only reason that I was able to look for this information is because a Scottish man named Lie to Me, Li32 Me, mentioned with the illness that people have experienced, it is connected to the vagus nerve. So I started researching this, and it absolutely does explain a lot of things. So the image I have on the screen, the vagus nerve, and it's actually two because it splits up and goes down each side of the body. It starts at the brainstem, goes all the way through the entire body, all the way down to the colon as well. And it doesn't just go straight down to nothing. It also is connected to major organs in the body. See if I can get this to come up. The vagus nerve controls the parasympathetic actions of the body. As you can see, it comes down from the brainstem, connected to the vagal, superior and inferior vagal ganglions, the pharyngeal branch. It goes to your pharynx, in other words. The larynx. It has branches that go off to the cardiac system and to your heart, and of course to your lungs. Pulmonary plexus, esophageal plexus, your esophagus, your spleen, your kidney, celiac plexus, the small intestine, the liver, and the colon. So the vagus nerve is connected to all of those. So let's look at the parasympathetic. I'm not sure why all my things have gone away and I'm having to redo them. Sorry about that. But the sympathetic nerves is connected to the fight or flight symptom, fight or flight actions. The parasympathetic nerves is the rest and digest. Pupils to stimulate saliva, to make the heartbeat slower, to constrict the airways, the cervical nerves, thoracic nerves, lumbar nerves, stimulate the activity of the stomach, inhibit release of glucose, stimulate the gallbladder, stimulate activity of the intestines, and also contract the bladder, and of course that other item which I won't mention. All right, so sorry, I'm having to go back up and find them again since it's not cooperating with me. When the vagus nerve goes up into the skull, it is also right with the jugular vein and another nerve as well. So, although this image doesn't really show that, the jugular vein and the vagus nerve go through the same opening up into the skull. So, when you have a problem with one, I can guarantee you're probably going to have a problem with the other because they're together. So this article here, the C word, 19, further linked to vagus nerve damage. So it was published in Elsevier Journal of Public Health findings that further linked symptoms of vagal nerve neuropathy to damage resulting directly from the illness. Some symptoms, such as difficulty swallowing, had been previously thought to be more likely triggered by a period of intubation, i.e., a ventilator, having the works stuck down your throat. But this study found that such symptoms also typically occur even in patients who never go intubated. The illness is known to cause neurological effects in 36% of infected individuals. This can lead to a number of symptoms, from mild headaches to more severe cases of, though rare, meningitis, epilepsy, or stroke. So the findings, and it mentions from where, said that this new study combined with other evidence indicated excuse me, that it was vagal nerve damage from the illness that was interfering with the body's normal inflammatory reflex, which normally inhibits inflammation and so contributes to the onset of the cytokine storm in the illness. So, yes, my body was in full cytokine storm. So, imagine that. There is a connection to exactly this. So, to look at further information, anatomy of the vagus nerve. The vagus nerve is the longest nerve of the autonomic nervous system and is one of the most important nerves in the body. The vagus nerve helps to regulate many critical aspects of human physiology, including the heart rate, blood pressure, sweating, digestion, and even speaking. For this reason, medical science has long sought ways of modulating the function of the vagus nerve. Anatomy of the vagus nerve. The vagus nerve, also known as the 10th cranial nerve or CNX, is a very long nerve that originates in the brainstem and extends down through the neck and into the chest and abdomen. It carries both motor and sensory information, and it supplies innervation to the heart, major blood vessels, airways, lungs, esophagus, stomach, and intestines. While there are actually two vagus nerves, the left and the right, doctors usually refer to them together as the vagus nerve. The vagus nerve helps control several muscles of the throat and of the voice box. It plays a major role in regulating the heart rate and keeping the gastrointestinal tract in working order. It also carries sensory information from the internal organs back to the brain. The function. Perhaps the greatest significance of the vagus nerve is that it is the body's major parasympathetic nerve, supplying parasympathetic fibers to all the major organs of the head, neck, chest, and abdomen. It's also responsible for a gag reflex, slowing the heart rate, controlling sweating, regulating blood pressure, stimulating peristalsis of the gastrointestinal tract, and controlling vascular tone. The vasovagal reflex. Sudden stimulation of a vagus nerve can produce what is called a vasovagal reflex, which consists of a sudden drop in blood pressure and a slowing of the heart rate. This reflex can be triggered by gastrointestinal illness or in response to pain, fright, or sudden stress. Some people are particularly prone to vasovagal reflex, and their blood pressure and heart rate changes can cause loss of consciousness, a condition called vasovagal syncope. Excessive activation of the vagus nerve is also seen in certain medical conditions, especially the dysautonomias. Stimulating the vagus nerve can have therapeutic effects, such as stopping episodes of supraventricular tachycardia or hiccups, and can help doctors diagnose certain kinds of heart murmurs. Vagal stimulation can be achieved quite easily by employing the Valsalva maneuver. The vagus nerve and the heart. The right vagus nerve supplies the sinus node, and its stimulation can produce sinus bradycardia. The left vagus nerve supplies the AV node, and its stimulation can produce a form of heart block. It is by producing transient heart block that the Valsalva maneuver can terminate many kinds of SVT. Because this vagus nerve has so many important functions, medical science has been interested for decades in the idea of employing vagus nerve stimulation or vagus nerve blocking in medical therapy. For decades, the procedure was a mainstay, of cutting the vagus nerve to help a peptic ulcer disease. However, that had several adverse effects, and I'm sure that would have quite a few. Today, there is interest in using electronic stimulators, and this such device that they are talking about would go under the skin of your chest, which, personally speaking, I would never consent to that. So, moving along. Sorry, I have so many things pulled up, but this is what I do, a lot of research. What is the vagus nerve? There are 12 cranial nerves in the body. They come in pairs. Sorry, it keeps moving by itself. And help link the brain with other areas of the body, such as the head, neck, and torso. Some send sensory information, including details about smells, sights, tastes and sounds to the brain. These nerves have sensory functions. Other cranial nerves control the movement of various muscles and the function of certain glands. These are known as motor functions. While some cranial nerves have either sensory or motor functions, others have both. The vagus nerve is such a nerve. The cranial nerves are classified using Roman numerals based on their location. The vagus nerve is also called cranial nerve X. So the fact that it says that that nerve can do both, such as taste, such as the senses like that, and many people have mentioned that they lost their sense of taste and their sense of smell. And I would ponder that for a moment and say, is it connected to vagus nerve damage? Okay, what does the vagus nerve affect? The vagus nerve, also called the pneumogastric nerve, is responsible for various internal organ functions, including digestion, heart rate, breathing, cardiovascular activity, reflex actions such as coughing, sneezing, swallowing, and vomiting. It plays a role in the autonomic nervous system, which controls actions people do unconsciously, such as breathing and digestion. It may also form a link between the gut and the brain, playing a role in what scientists call the gut-brain axis. In recent years, experts have been studying the gut-brain axis to look for links between conditions such as obesity and depression. Vagus nerve anatomy and function. The word vagus means wandering in Latin. This is a very appropriate name. Excuse me. As the vagus nerve is the longest cranial nerve, it runs from the brain stem all the way down to part of the colon. The vagus nerve sensory functions are divided into two components. Somatic components, these are sensations felt on the skin or in the muscles, and also visceral components. These are sensations felt in the organs of the body. Sensory functions of the vagus nerve include providing somatic sensation information for the skin behind the ear, the external part of the ear canal, and certain parts of the throat, supplying visceral sensation information for the larynx, esophagus, lungs, trachea, heart, and most of the digestive tract, also playing a small role in the sensation of taste near the root of the tongue. Motor functions of the vagus nerve include stimulating muscles in the pharynx, larynx, and the soft palate, which is the fleshy area near the back of the roof of the mouth, stimulating muscles in the heart, where it helps to lower resting heart rate, stimulating involuntary contractions in the digestive tract, including the esophagus, stomach, and most of the intestines, which allow food to move through the tract. And it's talking about vagus nerve testing, and they do that by trying to make you gag. They can also assess vagal nerve function when looking at cardiovascular disease. Measuring heart rate, blood pressure, and cardiovascular response to exercise can provide clues as well. Vagus nerve problems, nerve damage. Damage to the vagus nerve can result in a range of symptoms because the nerve is so long and affects many areas. Potential symptoms of damage to the vagus nerve include difficulty speaking, loss or change of voice, difficulty swallowing, loss of the gag reflex, low blood pressure, slow or fast heart rate, changes in the digestive process, nausea or vomiting, abdominal bloating or pain, depression and anxiety in people with breathing problems or heart disease. The symptoms someone might have depend on what part of the nerve is damaged. Heart rate issues, it's talking about bradycardia, which is slow heart rate, or tachycardia, which is fast heart rate. Gastroparesis. Experts believe that damage to the vagus nerve may also cause a condition called gastroparesis. This condition affects the involuntary contractions of the digestive system, which prevents the stomach from properly emptying. And it gives some of the symptoms: nausea, vomiting, especially vomiting undigested food hours after eating, loss of appetite or feeling full shortly after starting a meal, acid reflux, abdominal pain or bloating, unexplained weight loss, fluctuations in blood sugar. I find that one very significant because people who've gotten ill, like me, then have a blood sugar problem. And vasovagal syncope is the next section. The vagus nerve stimulates certain muscles in the heart that help to slow the heart rate. When it overreacts, it can cause a sudden drop in heart rate and blood pressure, resulting in fainting. This is known as vasovagal syncope. And besides fainting, you may also experience warmth, nausea, tunnel vision, ringing in the ears, excessive sweating, low blood pressure, slow or irregular heartbeat. And then it goes into vagus nerve stimulation, and it's talking about VNS, which is the machine, the medical device that they would want to place under the skin of your chest. Like I said, I would never consent to anyone placing anything in my body like that. Some of the things that help is diaphragmatic breathing techniques, cold water immersion, of course the VNS device that they would like to place in your body, biofeedback, and yoga. Excuse me. Then it goes into rheumatoid arthritis and the VNS device. The takeaway: the vagus nerve plays a role in many bodily functions, and it may form a link between areas such as the brain and the gut. Treatments that focus on the vagus nerve have proved to help people with certain issues. So, some experts believe that further research may offer clues to managing diabetes, obesity, heart disease, and other conditions that involve inflammatory processes. There is a medication that's mentioned, but it's called famotidine. Of course, I would never take that as well. That's just not something I personally would do. I believe more wholeheartedly in natural ways of dealing with something if you can possibly do that. The vagus nerve function and how to stimulate it naturally. And this says evidence based. The vagus nerve runs from your brain through your neck and chest to your abdomen. The function of the vagus nerve is to control your mood, heart rate, digestion, and your immune response. Stimulating your vagus nerve can help to regulate many functions in your body. Vagus nerve stimulation has been linked to treating certain issues, which I'm not going to name. After all, this is for informational purposes only. It is possible to stimulate the vagus nerve through massage, exercising, singing, intermittent fasting, and taking omega-3 supplements. The traditional way of stimulating the vagus nerve is by putting that device in your chest, which again, I would never do that personally. However, there are natural ways you can improve vagus nerve function with some simple stimulation techniques. In this article, you will learn about how your vagus nerve functions and how it is linked to good overall health. You will also find out how to stimulate this vagus nerve at home. What is the vagus nerve? You have one vagus nerve on each side of your body that travels all the way from your brain to your gut. Doctors say that this is the longest of the cranial nerves in your body. Excuse me. Of course, again, it comes from Latin meaning wondering. This is a fitting name because this cranial nerve has many connections and branches through the body. The function of the vagus nerve is also referred to as vagal tone. The vagal tone can be measured by analyzing the heart rate variability. Some studies indicate that it is possible to stimulate the vagal nerve fibers through breathing. This is why breathing exercises are good for reducing heart rate and helping to relax better. Researchers have discovered that slow-paced breathing stimulates vagal tone and helps to improve personal health. Vagus nerve function. The vagus nerve has an extensive function in the body and is located throughout your upper body. The long cranial nerve that is the vagus nerve connects the brain to the gut. The vagus nerve also helps the heart and your internal organs to function properly. Poor vagal nerve function is often associated with digestive disorders, poor sleep health, fatigue, and anxiety. Let's look in more detail at how the nerve functions and how the tone of it can affect your health. Vagus nerve function in the brain. Your vagal nerve plays an important role in how your brain functions. Researchers have found that the vagus nerve is the main connection between the brain and gastrointestinal tract and sends information about the state of the inner organs to the brain. Studies show that the vagus nerve function is also connected with other conditions. And it mentions also epilepsy and the VNS type device, again, which I would never do. Um, it says it can affect your mood. It can also, by improving your vagus nerve function, by improving your gut health, that can also help regulate stress and alleviate anxious feelings. Vagus nerve affects your gut health. Stress and anxiety often cause digestive upset because of the way the vagus nerve connects the brain and the gut. Researchers call the function of the vagus nerve the gut-brain axis. Stress inhibits the vagus nerve function and affects your digestive health. This vagal dysfunction can lead to various digestive disorders caused by inflammation and poor gut microbiota. In some cases, stimulating the vagus nerve in the gut using probiotics could be a novel way to improve vagal tone. This can help to treat symptoms of vagus nerve dysfunction such as IBS and IBD. On the other hand, stimulating the vagus nerve function in the brain through relaxation techniques, deep breathing, or meditation can have a positive effect on your gut's health as well. Other studies have shown that vagus stimulation helps to make sure there is enough stomach acid for digestion. Vagus nerve function also affects levels of intrinsic factor in your gut, which is needed to prevent a vitamin B12 deficiency. It's also connected to your appetite. Vagus nerve function and your internal organs. Your left and right vagus nerves are connected to most of your internal organs and help them properly function. For example, Cardiology Journal reports on a study showing that an increase in vagus activity can help reduce heart failure. Doctors found that using the device that I mentioned, increased nitric oxygen levels and lowered inflammation. Both of these are important in boosting heart health, and I would say try to do that naturally without a medical device. Just my personal opinion. Research also shows that vagal nerve activity affects the bladder function. Healthy vagal nerve function is also necessary for the kidneys to work properly and filter toxins. I feel like I have a kidney issue going on as well. So, all of this, everything I'm reading to you, directly relates with everything I've been experiencing with this illness. Experiments have shown that stimulating the vagus nerve helps to improve blood flow through the kidneys. Vagus nerve function affects inflammation. Very important. An important reason to make sure you have good vagal tone is to reduce inflammation in your body. Although short-term inflammation is necessary to treat infections and help the body heal itself, long-term inflammation can be detrimental to your health, such as a full cytokine storm. Chronic inflammation has been linked to diseases such as heart disease, allergies, diabetes, and cancer. Studies into the way the vagus nerve functions have shown that it helps lower inflammatory responses. They believe that enhancing the vagus nerve function could help manage inflammation-related diseases. Vagus nerve stimulation and how to stimulate the vagus nerve naturally. There's all kinds of suggestions here. Breathing exercises, aerobic exercising, massage, yoga. Some of the benefits of stimulating your vagus nerve include lowering blood pressure, improving cardiovascular health, enjoying better sleep, reducing anxiety, and boosting brain health. Cold stimulates the vagus nerve. Hum or sing to stimulate the vagus nerve. Conscious breathing benefits the vagus nerve function. Yoga stimulation for the vagus nerve. Mild exercising for vagus nerve stimulation. Probiotics can affect the vagus nerve and improve gut function. Omega-3 affects heart function and the vagus nerve. Massage to stimulate the vagus nerve. Foot reflexology to regulate vagus nerve function. Intermittent fasting, such as the 5-2 diet. Other methods: laughing stimulates the vagus nerve. Serotonin supplements affect vagus nerve function. It mentions also acupuncture. Muscle relaxation to manage anxiety and increase vagal tone. So also I did find a lady on YouTube that shows how to reset the vagus nerve and also how to do a vagal massage in your neck. Her name is Suki Baxter. Look for Suki Baxter if you're interested. I find that her one little short video on how to reset the vagus nerve. It also is supposed to release trauma from your body. How many of us have trauma? I would have to say probably all of us. So I do plan on trying her suggestion. She literally shows you how to do the vagus nerve reset. It's very simple and you can do it every day if you so choose. And again, this is not any kind of medical information. This is just for informational purposes only. I suggest that you do your own research. Don't take my word for anything. Do your own research. I did look on YouTube and I did find some people, and these are medical personnel, who are also connecting the dots here between vagus nerve damage and what people are having go on with their body. So in any case, I just wanted to share this information, and once again I do appreciate Li2Me, Li32M3, sharing this information, because if he hadn't, I wouldn't know anything about it. No one in the medical industry, and I say medical industry because it is a business, it's all about the Benjamins. No one in the medical industry has mentioned anything to me about the vagus nerve. No one, not one person. And believe me, I've seen a lot of them in the past year. So, in any case, I hope this information helps someone, and much love to everyone, and everyone have a great day. Namaste in Lakesh.